Idiot. I'm a for libido. Echo high. Condom where the family na mode zipline or elsewhere. Tony, zipline. Not botanic territory air day. The current state to sono air day.
Medasi. Zipline a contractor a bandada no a sign here. Almost sign say a befa ndro moja and the essential medicines and essential commodities are hard to reach. Hard to reach be in real time, maybe I was ambulance do and I say ye show be or ye de ndro befa sa drone no so I could do na omo etimi ahwe ye manfo no.
Okay.
Enti almost sign a contract. Contract about 200 something million, almost 300 million US dollars.
US dollars.
Almost say 6 centers. Each center every month Ghana 88,000 US dollars.
88,000.
88,000 US dollars.
Center near Juma wanya Juma. Wanya Juma.
Omo deliver they say no. Yanya diomoka 56 million US dollars.
Ghana the Zipline.
Contract number ended 2027.
Which is the next 2 years.
The next 2 years and a contract number end.
Okay.
Ain't here by na shade na it's okay. Mo my distribution list.
Okay.
Niama ma fast so far.
Okay.
The Juma my so far mo dem fambre. Ya so e be coffee da kohwe.
Okay.
Na niama ye hu ye no. Say essential medicines and I say emergency medicines no. Less than 1% and more etimi I deliver. Less than 1%. Now baby I friend how to reach as part of the contract.
Okay.
About 12.4%.
Okay.
Into a share yeah, and I say, share the total cost na ye spend as on mine. Any ejuma na omu dinner. The best thing is ye be share contract ne biom.
Okay.
Scanner a doors on the door.
Okay.
Ye inti mean to as scanners or mine. Into when I'm back to the table, let's have some discussion. Now he said credit me for mine second to us a deal way. Because say secure way or say secure way. You bet me investing in health sector no. We may not even need this. And I keep saying, so share the way are 56 million. 56 million. Yeah, take it. I was saying to you, watching get saying to you. Osha says it's my boss.
Yeah.
A bit me name P or health sector.
I see.
Yeah, enya ambulance and a form. Ye nyani and and so.
Yeah.
There any air ambulance. This amount of money could even get us air ambulance.
Is here an ambulance and I'm from?
Yes.
Any audio name so.
And them so can say His Excellency the President too about 3 years and
I see.
We have those ones.
I don't know. Ejuma.
Okay. Ejuma. The only thing left for our paramedics to be fully equipped.
Okay.
That's right. We are spending
50 cents a bit to air ambulance now.
We could buy a lot. About 300 million. Check air ambulance, boy.
I see.
So, share the priority. We are not saying say even say 1% and not 10%. We are not saying say it's not enough. But value for money. Whether or not say sikano yeno, whether we have value for money.
Okay.
That is what we are looking at.
Okay.
In TFO say paying the rest continue. If you continue, corporate Ghana never boa amaya. But the health system no, the gaps are who health system no, we enka gaps no. Where we are supposed to invest clearly in health sector, not areas like this. But yes, we will discuss, look at what we have to do as a mind. If they are ready to reduce the cost, no more reduce, so not no more a business. Now, Minister, during the press conference and ran what kind of hazard of the Parliament of the Republic of Ghana? In that hazard, it was clear, say, yen just be a Ghana, they will the Bremo, Munyusu, all of a sudden. Ye tiaka.
At the end of Bano?
Yes.
Free.
I call Parliament. You call Parliament, you say free. Because Parliament, you say, Minister, I don't Ministry of Finance and sign shares our document.
Yes.
Or say this particular project is not going to cost the country any money. That is why the Minister for Finance has not signed on that document.
It's on record.
On record. Minister Nekayan, right? It's on record. Then all of a sudden we are paying what we don't know. and we have paid huge amount of money. Now, a discounted amount. These are discounted.
A discount was
yes, and so you look at the whole thing, you ask yourself whether we should continue doing this. But no, we'll ask ourselves whether it's proper for us to continue paying.
Okay.
88 times 6. Whether it's worth it. This is a huge amount of money I are spending. No wonder the health sector has not gone forward as expected. Our core in the mess we're not able to put up hospitals. It will be beer. We are not able to complete the ones we were supposed to complete. Look at this money. Share Lightwave, Zipline.
Yeah.
The amount of money we have spent. These are just a few of them.
Companies
and no pen. Look at the amount. And look at that. And you ask, how much were we in need of as a country to develop the health sector? We could have done that. Yeah, in health system in other countries, we're moving to some localities here difficult.
Okay.
We have a clear health system.
Okay.
A robust health system.
Okay.
From a teaching hospital, you go to a regional hospital.
Okay.
You go to a district hospital. So it is linked.
They need to understand.
Yes. Oh, fly a draw echo chips compound.
Yes.
You don't have the required health personnel to even deliver.
Okay.
So until now, we're not able to make actually full use of the Zipline system. The other thing, yeah.
Because people say I am a tree and also. Because people say I am a tree and also.
Mate, you see. Osha amount of money I are spending on that system.
Okay.
Me feel say I was say yes a shred contract. I was say at Nancy na ye contract no. Na ye di year 2 year. Na Ghana for end deserve ni idea omo. There's
but
no way.
Items now near the deliver.
It be a blood donor card.
Okay. Blood donor card.
Yes, the card. It be condoms.
Condoms now on the far.
Yes, it be exams papers, uniforms, exercise books, textbooks. Say a spreadsheet. It's say when I deliver and I dey shit abrema. Never also and American apart from the essential medicines now these are nyama more deliver and also. That is why it was clear for you to determine what is the percentage. 1%. What is the whether there is value for money, whether a super ban for so I'm Ghana for. We realize a so intimate ban for so.
Uniforms,
yeah.
No, school uniform, and
yeah, school uniform.
School uniform.
Yeah. Now, I say want to say, why you could be presume a bomb, a basso, media network, be so say, or more ultimate transport, or more exams paper, and more in real time.
Yeah, I think so. But was that the purpose of the Zipline?
No. Ain't it a car? You must look at what I am paying. The internet me to us 88,000 a month. Me to for essential medicine.
$88,000 per center.
Yeah, per center
multiplied by 6.
Times 6 times 1 year. Calculated times a year. You see, ain't it a car? And yeah, as if obi tan obi na. We say juma. No, a year value for money. Say wow, we juma and so how will you feel?
88 times 6 near $528,000. $528,000 a month. Where for 6 no. Now you multiply no by 12. That's about $6.3 million.
Let's check ambulance, helicopter.
$6.3 million.
So
$6 million, $6.3 million.
And this thing started in 2018.
2018
and about
so
Ghana.
18, 19, 20, 21, 22, 23, 24. So that's 7 years. All the way so
times 7. Yeah, times 7.
7.
That's
a $44 million. $44 million. And as a condom, mosquito net, school uniforms, exams papers, and normal transport.
Textbooks. Apart from the emergency medicines,
no.
These are some of the things. So you.
Ministry no more than founds here.
Yes, I'm back for negotiation.
Okay.
We ain't to continue. Until I had 56 million.
56 million.
Yes, because you won't have reason to pay. Yes, it's can be. Because ministry why you pesca and free primary health care, you pesca Mahama care, pesca Niama Edim Faso.
Now, $56 million.
Niamo bet me. How? Ain't it?
Patients and
Obi beside me, and I say, "Now your person will be the funny sense. I know John emergency." Sanyin say no ba hard into the condom no dey hard there.
Condom and your friend is a mosquito net delivery become
essential. For which reason you are going to pay 88,000 a month?
Mosquito net, school uniforms, exams papers, textbooks, essential items. I say they call hard to reach areas.
Yeah, Fabian deliver.
But some times have been all contract. Man, I know the
No, a contractor still expire, but these are the terms. Terms means deliver essential medicine to hard to reach areas. Hard to reach if you have central medical store,
yes,
you can keep these commodities there. And now at the transport. Just a time you feel say in the past anti-snake venom serum.
Yes.
In communities and in period sa wo no it's ACC. Into no nearby and so best stock medical stores. You know, because there why there's an emergency system.
Okay.
A Ghana system na a robust one.
Okay.
So you know what happens within a particular period.
Okay.
Until you stock and then they deliver. You know where to put what.
Okay.
Except you have real emergencies. You have to quickly move medicines to. And I will share your problem as a country. Not any the major problems are your It wasn't part of our major problems.
Oh, some
major problems here. How to stock. Now all the drones are but not drones no not a drone anywhere or transport or heading.
Okay.
How to get the commodities available in country.
I think it got to a point here called Nigeria and malaria or one of the I think is it polio or what have you. The story be bad somewhere last year.
Yeah, so if you don't have only at the end
drone
will just be waste. If you don't have blood to transport, the drone will be waste. And we should have rather concentrated on these areas, getting the commodities.
Drone
yes, now
and condom.
Ain't a better condom. For condom.
Because
it
must work.
It seem to have
worked. So
check a condom a brand man on the
say a gold or what do you say?
Gold condom.
Gold condom.
Go ahead, be an honorable be honorable. We will plan our time, Papa.
But it's matter.
Yes,
it's a serious matter. Look at the amount of money. The amount of money.
$6 million a month. $6.3 million a month.
Yes.
Yeah. And initially said okay, most say I didn't for free.
But you see, Rance, what do you say?
Maybe say it's a second of Reatabano.
You see,
if
my memory serves me right, ambulance is about 307 B now. It was priced at the time, I think, $113,000 per one. This about $44 million. And the total cost of the 307 ambulance, I'm saying $40.8 million. Yes, $40.8 million. Enti sanka ye to extra 307 ambulances can ukrepa. It means that we could have done better. How do we sit down and shortchange a country like Ghana? Your population here.
Said they're glad there, but I say in Rwanda, the drones are delivering essential services to remote communities. I see them every time, and I have seen them delivering at hospitals.
But
that is Rwanda.
Rwanda.
That is what I keep saying, sir.
I want to say
Our health system, yes, our health system is different from Rwanda. Somebody sent the same thing to me on Facebook. And I said, you don't even know the system we are talking about. We may not have a perfect system, but I can tell you that what we have is well networked.
That's true.
We are not saying that we have a perfect system, but compared to other African countries, as I speak to ICASA, which is one of the biggest AIDS, tuberculosis and malaria conference, it's happening from tomorrow in Ghana till Monday. After that, another huge conference, which is African ministers are coming to Ghana to have another conference in Ghana. Ghana's health system is recognized worldwide. It's robust. You can where they have this, it may work because that is the system they have. They have a centralized system that transmits. The drone will be taking the medicine to the people. We don't have that. We have a decentralized system. We have CHIPS compound, we have polyclinic, we have centers, we have district hospital. In an encatchment area, if they find it difficult, they move to the referral point, which is the regional hospital. That is what we have. We have realized that we need regional hospitals, 6 additional regional hospitals, because we have created regions without hospitals. Yes, first 3. That is how the thing is working on. Solving real problems, we're creating region. So it means that the referral process, so let's quickly build facility. That is what we are doing. We are teaching. Lagos needs a facility. We have put UGMC. If you don't have this system, overfly drone, never call land, you don't have human beings to work. Drone no qua. Every health worker, near a WhatsApp or yeah, made the blood health assistant clinic. Flyer baby air corner. Why so? We are not saying that they have no work, but a Juma no Mayan far lesser than the amount we have paid. Let's face the facts. You see, and let's not attach emotions to some of the things we do.
And this way you can't criticize it too.
No. Just look at the cost.
Shall I like to issue? You are supposed to deliver about 950 services. We've done 450. But you've paid 77 million. Is it cedis or dollars?
Dollars.
$77 million. Contract worth $100 million. Nipa na half of a Jumana with the Ashan. But we've paid more than I think that's about three quarters of what we are talking about.
We should take away emotions. Let's look at the real issue.
I think the various hospitals, the workers have done a disservice to this country, because if you know your work very well, and you know that drones are supposed to deliver essential services. Last year, the condom, mosquito nets, mobile. Somebody somewhere should have hinted the appropriate court and said, the things we are receiving here are not
essential items or
materials. And now they put in the request. But if you're going to put in a request, you cannot do this in
Rwanda. Sex in your emergency. And what I say, when you condom, to accord the next time. So sex is not something an emergency. So who are the drones condoms? Who are the people who put in those requests?
And it's not as if we have made these stories up.
Supply, it's a way bill.
And also the Niamaba. And never better the buy.
They have done a disservice. Those who requested it, what was it for? Into our requested condoms. Probably for educational purposes. But for educational purposes, it is not an emergency, for God's sake.
Now, school uniform, no. Educational purposes for
textbooks. Hey, this one, I think people have to be
people
it must be investigated very well. And
Yanku enemy kakrana kwasipo kunmomram. MP for so adaroma e boa yen. MP say auto